All right, so we are starting another session, and this session is going to be on ethical questions. And this is going to be another group session. And I will give a few answers, a few sample answers. And sample answers I took directly from the course, from the program. And I'm going to show a little bit about the program as well, so that people are reaching out to me. They have some issues sometimes going through the program. So I wanted to just show it again. But let me just share my screen and we'll just go over a little bit. Okay, so let me see, share screen. All right. Okay, when you make your account, you get links in your email. You make your account. You come over here, dashboard, student dashboard, and you click on the course, open. All right, and you get your different modules on the side. And as you see, each module has multiple lectures, possibly one or two videos, and then template answers. And we're covering multiple specialties. Yeah, so multiple specialties. And so, yeah, multiple specialties, multiple templates, for example, internal medicine here. So there are 3 templates here, pediatrics, templates. I'm adding a segment, a transition sentences that, for example, will tell me about yourself. So it's always good to have a transition sentence up front. Let's say, for example, well, that's a great question. I know it was coming. My journey has been quite unique. So let me give you some highlights that go beyond just my CV. So yeah, something casual before you actually get into the question. Strengths questions, but since this session is regarding ethical questions, so we have a couple of ethical questions. So yeah, with template answers as well. So it will fit your specialty, internal medicine, family medicine, pediatrics. So make sure you guys go over this. And yes, let's get you some template answers. And
We can go with a family medicine if you want. Like,
yeah,
we both have a family.
I'll do like a mixture, family medicine, internal medicine, internal medicine, and we'll just discuss in brief. So ethical questions are huge. They may not ask too many ethical questions, but they do come. They do come. And the thing is that you just need to have a framework. The framework with ethical questions is everything is circled around patient care. If you're able to master explaining that patient care is the most important thing to you, that's it.
Okay.
Whichever situation it is patient care. Patient care is number one. You could be hungry, you don't eat breakfast the whole day, but if you're able to operate, if you're fine, patient care. Let go of your family business, whatever, but patient care. If you have to leave due to a accident in your family, whatever, you have to make sure that somebody else is going to take over your patients before you leave.
Right.
Patient care is number one. Okay. Right. So that is the answer. That is the answer. So let me just go over a few let's say template answers.
Yeah. And yeah, Dr. Ken, I was going to say something before you move on. So given that concept of patient care being central to everything we do, I come across a question that was saying that you are just parking at a hospital parking lot, and then a patient asks you for a ride to the next train station. And the question was, what would you do? So to me, I was confused. I don't think if you ask me, I would be like, well, why not let me, you know, call Uber for you or something like that, than me driving my patient to the next train. So not my patient, actually. I just saw him at the parking lot and they asking me, what would I do?
Right. Yeah, that's a good question. And come to think of it, um, it sort of differentiates your responsibility when you're outside the hospital. When you're in the hospital, right? You have a social worker, you have a case manager. If the patient needs transportation help, they're able to help out, right? So in this scenario, what you will do is you will say that definitely patient care is, of course, my first priority. And in the hospital setting, I know we have a whole team that is helping out with the patient. If the patient is just in the parking lot, and I would definitely look to call my case manager and the social worker and see if we can provide the patient with a voucher, and to see if they can help. And I know that there are taxi vouchers available that social workers are able to provide to the patient. I would definitely ask the patient if he has any significant hindrance and any significant issue that is impeding his travel to his house. Normally, during the hospital, I would make sure with the nursing staff and the case manager staff and social worker staff that the patient has a ride, has adequate means to go to where they need to go. Usually that will take care of it. However, in this situation, the patient is in the parking lot. I will reach out to the social workers, and if feasible, they will be assisting. However, if it is not too much out of the way, and the patient is an all right individual, which I know about him or her, I would not feel bad. I will not be fully reluctant to help him or her out, and it's not too far away. And if significantly, if it is along the route which I go, definitely I will look to help out the patient, just to make sure that the patient gets to where he or she needs to go. Hopefully it's not too far away, but if it's nearby, I would definitely look to help. You can just give it an answer like that. Anything is usually fine.
Okay. Sounds good.
But good question.
Thanks so much for that.
Yeah.
Sir, what if if I'm modifying this question, like what if they are going to ask the patient is deteriorating in a parking lot, what will be your role in this position? And you are leaving the hospital. You are done with your job, like done with your 20 hours.
Right. So when a patient, now this is actually a legal question, because the hospital is responsible for the patient in the parking lot. So you will basically, if you see that happening, right, the patient is deteriorating, the patient will need to be brought back to the hospital. The patient will come back to the ER. And I believe there was every hospital has a team called a rapid response team, which can be called, which can go to any location of the hospital surroundings where there is an issue.
Right.
So you could pick up the phone, you can use your phone, call a rapid response, the location of such, and the team will be available to come and assist the patient and take the patient to the ER. Yeah. So it's a responsibility of the hospital, and you are off. You can still pick up the phone. You can use your own phone to make the call and get the care going for the patient.
Sounds good.
Yeah.
Sounds good.
Yeah. I think this thing happens. It happens every now and then.
Right.
Okay. So let's go over some of the questions. And first thing, relatively common question is an error. If you made an error, tell me about a moment that you made an error in whatever role you had, and what happened, and how did you deal with that? Okay. A common way to answer this is possibly a medication error, and medication errors, minor errors, do happen. And one thing to note is that you don't want to describe an error that was really bad, that was highly injurious to the patient's health, or caused the patient to die, or something, or significant morbidity or mortality. All right. That is because that if you explain that, then you would create a distaste with the interviewer. So I would recommend, if something bad happened, don't use that case. Use something minor. So let me just sort of give an example. Okay. So yeah, good question. And I do recall that I made a mistake when I ordered a dosage of vancomycin without looking at the vancomycin levels. And this was a patient with the renal impairment. And I needed to adjust for kidney function as well as for levels. And after reviewing the chart later, I realized that I had ordered the wrong dose. The patient did receive the dose. However, I was in my I was in my final year of medical school, and we were doing a sub internship. And I informed my resident, who then, of course, informed the attending as well. I explained my mistake, and now I am measuring closely the patient's vancomycin levels, and no untoward episode happened. The patient's kidney function remained stable. This experience that definitely taught me the importance of thoroughly reviewing a patient's medical history and labs before placing any of these orders, and making sure that medications that need adjustment and titration and monitoring, that I don't lapse on that. I developed this habit of double checking renal function before prescribing medications, and levels of medication that need to be tested. And I always make sure to review the chart carefully before I make any of these changes. And hopefully I don't make any of these mistakes in the future, and I have not. Yeah. Okay. So that sort of is an example for an inpatient, right? Next important question that usually let's go for a mistake. Let's say in a family medicine location, right? Let's think about a family medicine location. So let's say, okay, so during one of my rotations, I was managing in clinic a patient with hypertension, and I had scheduled follow-up visits to review the patient's blood pressure readings after we started some new medication. But I forgot to arrange a blood pressure device for them. And I forgot to tell them that they should be checking their blood pressure reading 3 times a day, perhaps. And when the patient returned for their follow-up, their blood pressures were still uncontrolled, and we had no readings to adjust and make a better treatment plan. So once I realized this, I apologized to the patient and ensured that they had access to a home blood pressure device. I also scheduled regular check-ins to review their readings and adjustments if needed. And this experience definitely taught me the importance of consistent follow-up and proactive management of chronic conditions. And since then, I have implemented a reminder system that if a patient needs a medical device, that I don't forget it. But this was a learning experience for me. And from now, I haven't had any further episodes of this. Thanks for asking the question. Okay, so this was for a sort of an outpatient setting, right? And then ethical question comes about constructive criticism, right? Okay. So, so because that is also very important for not just ethical reasons, but just how you relate to it. And many of us may have had good experiences or bad experiences, usually bad experiences with constructive criticism, because it happens that the person who's providing the criticism may not be that constructive. They may be more condescending or demeaning. In that way, the criticism is actually, you may not call it constructive criticism. However, you previously had a bad understanding of anybody giving you feedback, and you may be a little reluctant. However, in a medical environment, you should always be open to constructive criticism. Okay, and usually it will always be the question regarding constructive criticism. Usually, again, you have to show your willingness to listen to and assimilate that criticism into a positive manner. Okay, so let's give a sample answer. Yes, good question. And I've had 1 or 2 episodes, and I do see constructive criticism as a valuable opportunity for growth. And I do actively seek to improve myself and my skills. So during one of my rotations, I did receive feedback from my attending that my patient presentation skills needed more structure and detail. Initially, it was a bit difficult to hear because I thought that I did prepare well, but I quickly realized the importance of this feedback, and I asked for more specific examples and guidelines on how to improve. And I have since then implemented these suggestions. And from the very next presentation, not only did my presentation skills improve, but I also gained more confidence in presenting more complex cases. So I do feel and I welcome constructive criticism, and I look to apply it because I am definitely in my learning stage, and any stage I will be in the future. I will look to mentally be always open to constructive criticism, and I've been able to grow continuously, and I'm looking to refine my skills with my patient care. Good question. Thank you. Okay. So you just have to say yes. And that's a good way to deal with life in general, right? It's difficult sometimes. It can get frustrating sometimes if the person who is delivering the criticism is not doing it in a objective manner. They may have, a few pieces of ridicule in there that you may not appreciate. That's usually what happens in life.
It's true.
But generally, you will be very forthcoming and looking forward to constructive criticism.
Yeah.
Okay. And then let me look at my notes. Then a common question that comes is if your senior or attending or whoever is under the influence of alcohol or any other drug for that matter, right? So any other, it could be marijuana, it could be alcohol, it could be benzos, whatever, right? And maybe the scenario will be that they had a party last night, the whole half of the program was there, somebody drank a little more, right? Somebody drank a little more, had too much fun, right? So they will pose this type of a question, and how would you handle that, right? You see you're in rounds and the senior or the attending or somebody else is slurring their words perhaps, or doesn't look as awake as they normally do, right? So that sort of is the question, and it would be that let's go over the answer. So let's give you some template answer. So good question, and I know episodes like this and situations like this can happen. We are all human, and although it hasn't happened with myself that I ever came in drunk or anything similar, but if I suspected an attending was working under the influence of alcohol, my first concern would of course be patient safety. And I've learned that patient care is a team effort, and everyone is responsible for maintaining patient safety. I would look to discreetly observe my attending's behavior to confirm my concerns. I would not jump to conclusions. And then I would report this situation to a senior resident or a supervisor immediately. I would explain my findings that I have not confronted my attending. However, this is what I have witnessed. Please do investigate if you feel is necessary. I just want to make sure that patient care is maintained. So that's how I will look to approach it. I would not to create an issue or a scene in front of anybody, because we don't want to humiliate or belittle anybody. So I would ensure that the situation is addressed professionally and promptly. That is important. And by reporting it to the appropriate authority, I look to protect both the parties, patient as well as the integrity of our healthcare team to ensure adequate healthcare delivery. Hopefully this never happens, but I will look to follow this track in case it does happen. Thanks for this question. Thank you.
Okay, sounds good.
Okay, so so that's, I think, to be honest, it had never happened with me that I've seen somebody, drunk in the hospital, but this hospital, clinic, but these things can happen. if I give you some, just take a stab at it. Raja, do you want to take a stab at it?
I will try.
Huh?
I will try.
Okay, yeah, that's fine. Okay. Dr. Raja, great answers, and I love your history and everything else. It's all good. So it happens every now and then that you get into an argument with your colleague, right? You get into an argument with your colleague, and you have a disagreement about a medication, perhaps. Have you got into arguments before? How have you handled it? How have you dealt with that?
Thank you for asking, and I don't remember exactly. I had never had this kind of situation, but in that condition, I would not like to confront my colleague or senior, but I would go to research the topic and research the medication if there is any side effect which is affecting my patient. So we can discuss and come to the conclusion afterwards and decide for what's best for the patient and best for us, so we can get on the conclusion, better conclusion for the patient care.
Yeah, that's actually, yep, that's good. I mean, that's right. You will, again, your point is valid about the outcome. What is important is patient outcome. The patient is not affected, right?
Yes. Like I will sort it out in a way that we can discuss the medication with each other. If his point is good, it's validating the patient concern, or my point is validating, so we can conclude on same. We can come on same page and discuss for the patient's betterment, like patient's patient outcome was best for the patient specifically.
Right. I would just do one thing, that my interactions with my colleagues rarely ever result in any confrontation, and I've always been a good communicator, and I've actually never had a confrontation in my experience. Although my experience is not that vast, I'm just going into residency. However, I do feel that the most important thing to me would be patient care, and that the patient receives the best care in any situation. And in any situation that there's a disagreement between myself and a junior resident, or my colleague or a fellow intern, rather than allowing that disagreement to create tension, I would definitely, step back a little bit and try to ease the situation. And I would explain in plain and calm words how I feel is the approach for this patient. And if there's still a disagreement, we would agree to disagree, and we would get together, and I would suggest we go and talk to the attending physician or our senior resident. And this would allow us to get to the bottom of what we should do with the patient. So I believe that this is one strategy that we could apply, at least at my level, internal resident level, in a residency program setting. I would look to step back, not to confront, and try to reduce the temperature if the temperature or tension is more than that is desired. I would definitely talk it over first. If we have not resolved it, we will approach our senior resident or leadership, perhaps, or attending, perhaps. A good question. I know this could definitely happen. Okay.
Perfect. We can go we can discuss with each other. We go afterwards if there is an agreement with a disagreement, that we can go with the literature, and afterwards attending stepwise. We can discuss it with you.
Yeah, step. Yeah, you can do anything, but this is what I would say: first discuss amongst each other. Doesn't work, then escalate. And
yeah,
I
agree.
Let's see. Let's do another question. Let me see my notes. Okay. Let's do a question on. Okay. So this is probably your behavioral sciences question.
Okay.
What would you do if you found that a senior doctor was having an affair with a patient? Right?
Yeah.
So you know the rules, right?
Yeah.
The rules
Yeah.
are right that a psychiatrist can never have a relationship with the patient, whether they're
That's true.
retired, everything. Whether
Yeah.
a medical person or somebody else can possibly have a relationship. I mean, don't quote me on this. It's been a while since I did my behavioral sciences. But if you discharge the patient from your service, the patient is the person is no longer your service, is your patient, then you can maybe look to have, and you have to wait some duration of time, something like that.
Yeah, that's true.
It's a no. You cannot have a patient, and you cannot be dating or relations with the patient.
Yeah.
So
once again, I will repeat the rules, like psychiatrist, one thing, and the other doctor is, if it's not in our service, then we can have a date with the patient. That's what I'm concluding from your discussion. Is
yeah,
it
and I
correct?
believe there was a time period after which patient has to be completely out of you're not dealing with the patient's medical things at all. Yeah, let me just quickly Google actually.
That's actually not that bad.
Yeah, a doctor cannot have a relation with their patient. The American Medical Association Code of Ethics and other medical licensing and ethical standards prohibit romantic or sexual relations between doctors and patients. Okay. Yeah, so you cannot have
the Minecraft eating on the sheet is actually so creepy.
can you ex-patient, let's see. Yeah, the physician, a doctor can have a relationship with the former patient, but it's generally not appropriate. So yeah, it depends on how bad is the situation you create that the medical licensing board can come after you.
Exactly.
I say avoid it, right? So
yeah, avoid it as much as you can.
Right.
Yeah. Coming back to the question, then what would be our role if I'm going to see my colleague is having affair, like doctor colleague is having affair with the patient? In that sense, I would say I will confront the doctor, like my colleague, first, and ask about the situation, what's going on. If I'm feeling like that there is any tension between patient and doctor, I will try to ask him not to do this again. If doctor is reluctant to it, like my colleague is reluctant to this thing, I will go to my higher authority and report the doctor. Is that the correct answer?
Yeah, I think that's in line. That's in line. Yeah, that's in line. So every hospital has an ethics committee or something similar.
Yeah.
There are protocols, and whenever you're in the hospital, they have educational modules that describe who to reach out to when such a situation happens.
Yeah.
And so when such a situation happens, there are sort of protocols.
I feel like being a resident, my first person to contact is like program director. I feel like maybe associate program director.
Right. Yeah. I mean that in this level, it's fine. I think it's more important to identify. Let me just give you like an example answer for this. If I found that a senior doctor was involved with a relationship with the patient, I would recognize that this is a serious ethical violation, and maintaining professional boundaries is critical in protecting patients. I will look to discreetly confirm the situation by observing and gathering any necessary information without making assumptions, because that is definitely not allowed. Once I was sure, I would look to advise my colleague that, hey, I'm not sure if this is happening, but just be careful, and I don't think this is allowed. Be general, be frank, don't be aggressive. And if you see a negative answer or an answer that suggests that they are not going to follow your advice, then it would be appropriate for you to report to the hospital's ethical committee or administrator following the institution's protocols. And I believe it is important to maintain a boundary and keep the integrity of the medical profession in the highest regard. And I would look to ensure that a situation is adequately addressed appropriately. And I would think that would be a priority for myself. Yes, good question. I believe you can also say that you do not need to confront the individual because that may create animosity.
Exactly.
It would still be appropriate and
exactly. Yeah, that was what I was thinking. I was like, if I'm going to confront my colleague, wouldn't that lead to confrontation and then create animosity? And then if anything happens along the line, my colleague will see me as the enemy.
Exactly.
That caused the
Yeah, you're right. I would rather prefer that we don't say that we confront the individual.
Yeah.
And then the ethics committee can investigate if they want further.
Exactly.
Because the thing is that if it's a hospital or a clinic, if there's a lawsuit happen, right, it's not just the doctor who's going to get in trouble. The clinic, the hospital, the health system is going to get in trouble.
Right.
So it's not just the physician who will be at fault, because this is against the code of ethics,
Right.
and against the AMA guidelines. So they will. It's a problem of the institution to make sure that these things don't happen. It's not your personal problem, but it's a problem for the bigger institution. So you don't necessarily have to confront. And I would say don't confront. In your answer, I would verify. And if the suspicion is proven, then I will move forward with the institution's policies and protocols of how to address this and how to report this.
Yeah.
So, doctor, how we are going to verify the patient doctor has a relationship with the patient? What if they are asking follow-up question of that thing, how you will verify? And what will be our answer in that situation?
If they say that, well, I mean, you will only have suspicion if it's obvious.
Yeah.
Okay.
Right? Because if this is happening in the hospital, in clinic.
Yeah.
Okay.
Like patient is visiting doctor again and again without any reason. Maybe.
Well, yeah, I mean, in that case, no, that's another ethical question. Okay, that's a different question. That is a different question, actually. But let me just address what you just said. So how will you investigate? You will not go out of your way as such. It normally will happen in front of you. It will happen in front of other people. And you will know that this is not correct. It will happen. You won't go to the person's house. Okay. You won't go.
Exactly.
If you see them if you see them outside and you know about the patient, or the patient says, yeah, he's my doctor. Yeah, that's a big problem, right? So that's how you know, but you will not go out of the way and looking through his diary or stuff. You will not do that.
Okay.
Okay. So yeah, you will not be the investigator. That's not your job.
So just concluding the answer, if I'm suspecting anything like that, I have to go to the ethics committee and report it there anonymously.
Yes.
Not in front of doctor, in front of my colleague. Okay. I have a follow-up question, from previous question, that a doctor, my colleague is drunk or is under the influence of any illicit drugs, right? So should I confront in front of him, or Sam, should I go to
you will
any
not
ethics?
confront.
I will not. Okay.
You will not confront.
I will report it to ethics committee directly.
Supervisor, higher up.
Okay.
Yes. So your
Hierarchy.
question that you mentioned in the middle, that the lady or somebody keep on coming for appointments.
Okay.
So that basically, they don't need, if they're together, they don't need to meet in the clinic, right?
Yes.
So that happens when, for example, let's say a male or female is interested in the doctor, and they keep on making excuses to come and visit the clinic.
Yeah.
This is a family medicine question, right?
Yes.
Keep on making excuses to come to the clinic, right?
Okay.
In that sense, if the doctor suspects that behavior, then they need to have a chaperone with every encounter.
Yeah.
Nice.
If you suspect, it happens a lot in the hospital, not just for this situation. If there is a sexual abuse female that you're caring for, always have a chaperone.
Yeah, that's like a CK question. Step 2 CK question.
Yeah. If you have like an aggressive patient, patient has been argumentative, you have a secondary person in the room.
Yeah, it's true.
So yeah.
Yeah, and Dr. Roger, I was going to say something. Maybe Dr. Khan will agree with us. So in this issue of managing if a colleague is under influence or having an affair or relationship with a patient, my feeling is that the way we handle it under interview situation and exam condition might be a bit different from the way it happens in real life. I don't know if I'm correct.
No, we have to follow these rules. I believe, like, if I'm reading, like, if we are reading literature, so we have to follow this.
Yeah, because for example, what I'm trying to say, okay, if you are my friend now, for example, and we work in the same hospital, and I see that what you're doing is like, hey, it's out of the way, I might be like, hey, man, come here, let's talk about this. This is not correct. Don't continue with it.
It's not a confronting. It's like discussing the things. We can use this word like not like discussion rather than using the word confronting. Like it will be suitable. Like, what's your Dr. Khan views on this?
If I understand the conversation, confronting, no, I don't think we will confront them.
Yeah, that's why I'm saying that we can use word rather than using the confront word. We can use the discussion.
Discussion is probably a better word.
Yeah.
Right.
Like in a friendly way, like Stephen is asking, like in a friends day, it's a normal in our culture that if we are good friends, we like, okay, is there any something going on, like in a jokingly way, like not confronting in a jokingly way, in a discussion way,
in a very friendly way.
We're in a friendly way, basically.
Yeah. So I mean, in real life, if your friend is or your colleague is, dating that he should not be dating, right? So, America is a very litigious society, right?
Okay.
So if, something happens to the hospital, the woman or man sues the hospital that, hey, I was having a relationship with your doctor and I realized it's not good, and the doctor did not prevent the relationship. Oh, and he also knew about it.
So if I'm having a relationship with a patient and Stephen knows that, then Stephen will be in trouble too.
Exactly.
Yeah.
So Stephen,
yeah,
I'm not your friend in that case.
I got you.
So just be so that's it. Yeah, that's the thing. That's another question. Maybe I don't know if they'll ask this question.
Yeah.
Anything else in mind?
We are good with it.
Okay. All right. Yeah, just go over the questions and answers. Okay. Tomorrow will be again a common questions. Let me see. Let me just look at it. Tomorrow will again be a common questions.
Like we will work on like tell me about yourself, weakness, strength, and we can go over the questions to ask from program.
We can do that as well. Yeah. That is a common question. You're right. Yeah, that's a common question.
Yeah, and let's make the tomorrow session. Tomorrow is Sunday. We can make a good, better, like bigger session. So we
Yeah,
can
I'm
speak
actually
up
doing it.
later.
Where are you, Suraj? I forgot. You are in
Florida right
okay,
now.
that's fine. I've scheduled a session for 9 p.m. Eastern time.
Okay.
So that's 1 hour earlier.
Okay. We can go over 1 hour, 2
Yeah,
hours.
that'll
maybe.
be that'll be a little bit more. Yeah. I'm actually working this weekend. I have to be in the hospital at 7 in the morning.
Okay.
But yeah,
Okay.
so good. I think you guys are, getting there. And yeah, we'll prepare. We'll prepare these things.
We need to prepare robotic answers honestly, and ethical questions are good, like as we discussed today.
Right.
But the robotic questions, like tell me about your weaknesses, and they are like robotic ones.
You have to practice. You have to practice it.
Yeah,
Some
that's
are
why I'm
Yeah.
asking. Like I'm like a little bit anxious, like answering these type of questions, like robotic ones. So that's why I'm asking you to. We can have
practice.
a good
Step
session.
in, connect with him.
Yeah.
Practice. Use a mirror. Just
Mhm.
practice. Just practice.
Okay.
And the
Yeah.
other way is bullet points. Think in bullet points possibly, but practicing just helps. Practicing helps.
Sir, I have a question. Like my glasses shows the shadow of the PC. Like everyone is asking to keep the notes in front of you, like sticky notes and pointers. Should I keep this like this, or like should I
Notes.
put notes like sticky notes in front of me?
You could. I mean, who's preventing you? You could have
No
some.
one is preventing me, but the my like
But
my
I
shadow
think
of eye.
I think
That's
you
it.
have practiced enough that you don't need notes.
Yeah, I would agree with that. I would agree with that. That is exactly what I'm trying to do myself.
Yeah.
Overall, I'm just trying to be myself. I know it's not easy, but I feel like being myself helps me to even make more constructive statements quicker and still get to my point. I mean, not say everything I want to say, but at least I'm able to spit out the real point within a given time.
Right.
Yeah.
Right. So one point. So I want to just point out your cameras. So Stefan, your camera is fine.
Okay, great. Thank
One
you.
thing I'm noticing, if this is your interview place, it's shaking. Whenever you're talking, it's shaking. I think.
Oh, I'm shaking my table. Sorry.
Yeah.
On my table. Okay, let me get off my table.
It's shaking.
Yeah.
And Suraj, so
Yeah,
your
this is
camera
my
needs a
nightmare
little
play.
improvement. Your camera needs a little improvement.
Okay, and no, this is not my place right now.
Okay.
I'm sitting in a like.
Oh no, this is too bright.
house.
You're fine. The light is fine.
In the
Okay.
morning, we will have an interview in the morning, so light will be like adjusted accordingly.
Yeah. Is this your laptop or is it something else?
Mine one is laptop, like.
Okay.
But Stefan's camera looks good, and obviously yours camera is perfect.
Yeah. I mean, I just prepare very quickly, so my camera is causing some issues that is squashing me in Zoom. So
Okay.
I mean, I'm not preparing for the interview, but I'm not spending time to fix it.
Yeah, of course.
Yeah.
Of course. Yeah.
So
my camera is blurred, right, sir?
yeah, it's so just see what you can do. See what you can do.
Okay.
Can clean the camera face on your
No,
laptop.
I think so. My background is blurred. That's why it's showing it like that way. Let me check.
Check your
While
resolution. It should be
Dr. Raja is doing
1080
that,
by
Dr.
720.
Sorry?
Okay.
So your resolution should be at least 1020 by 1080 by 720.
Yeah, I will. Otherwise, I have to buy a new laptop or maybe.
No. You don't need a new laptop. Just do you can get $50 to $100 webcam from Amazon.
Oh yes, I can do that.
Yeah. Should be good.
Now
It's better. Maybe if the lighting is better, it'll look better. It's still
It's
very
better
grainy.
than
like
before.
I kept HD appearances.
This is far better than before.
Yeah, it's much better than before. Exactly. Yeah, it is much better.
Now. Okay. It's much better than before?
Yeah, it is much better than before. Maybe
This is better.
lighting would do a better job. Yeah.
Okay.
Yeah. Okay, good.
Thank
Good.
you, sir.
All right.
Yeah, we need this thing.
No, this
at
is
least.
this is important. You have to do do
Yeah.
this. Yeah, it's very important.
Because I'm in an Airbnb situation, so
Right.
I'm like a little bit confused. Should I buy another? Like, I have a HP laptop, maybe
No,
Apple laptop works.
I think it just investigate your webcam,
Okay.
and
Yeah.
I would
And
say your
any
audio is
recommendation
fine.
for webcam?
Yeah, audio is fine. Maybe just a regular webcam with good reviews. USB webcam with good reviews. I think should be fine.
Yeah.
Okay.
Yeah.
Thank you.
And maybe the lightning also is something you want to consider.
Yeah, lighting has to be from your front. Right now, it's coming from your top back.
Yeah, it's from the top, like.
Yeah.
Yeah.
Yes,
Right.
maybe.
But that's you'll just.
But interviews will be in the morning, and Florida is like we sunsets around 7-8 p.m. So
Okay.
there will be a
So-
good morning light.
Yeah, in the morning light.
Okay.
So if you have to face the window. The window can't be
Yeah.
behind you.
Yeah.
Okay, so
Yeah.
that's going to be important. The window can't be behind you. Right.
Yeah. Yeah. Now I have to buy a light. I'm Canadian, so it's snowing here already. So 8 o'clock in the morning is still dark in this place. So,
Mhm.
I can't depend on the light from the window at all. Yeah.
Yeah, in front of you. But it's nice. Your setup is okay. It looks nice
Yeah.
and clean. Just
If
find a
you
clean.
if you have interview with family medicine, I think your background is like family, so perfectly matches your like.
Exactly. Yeah.
Exactly.
Sounds good. Sounds good.
Exactly.
Yeah.
Good, guys. So yeah,
Yeah.
hope tomorrow another session. And then
Mhm.
Okay.
Yeah,
connect.
hopefully.
All right.
Yes.
All
Thank
right.
you so much, guys. Thank you.
Thank you so much.
Okay. Yeah, Dr. Raja, let's connect on WhatsApp quickly so we can plan our schedule for the
Yeah,
next
sure.
few days. Yeah.
Yeah,
I'll call you
sure.
on WhatsApp right away.
Okay.
Yeah.
Thank you, Dr. Khan.
All right.
Okay,
Thank you,
bye-bye.
Dr. Khan.
Bye-bye.
All right. Have a good night.
Have a good night.
You as well. You as well. Thank you.